Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Amaida Mir and I am assistant professor in Department of Anatomy. Today our topic of discussion is the knee joint. As you know, the knee joint, which is one of the largest joint of our body, this joint is formed between the three bones. The upper bone, which is called femur, the lower one, which is called tibia. In between the femur and tibia, there is another bone over here which is absent in this model, and that bone is called patella. You can see that beneath the tibia there is another bone which is called fibula, but this bone does not take any part in the formation of the knee joint. This lies below the tibia, so this bone has zero contribution in the formation of the knee joint. Now the type of the knee joint is synovial hinge joint. The joint between the femur and the tibia is synovial hinge joint, and the joint between the femur and the patella is synovial gliding joint. It gives different type of the movements. For example, it provides flexion, this is the bending, extension, which is a straightening, then a little bit rotation, or this is also called the gliding movement when the two surfaces slip over each other or move over each other. This is gliding movement, and the medial and lateral rotations. So it gives four type of the movement: flexion, extension, medial rotation, lateral rotation, which is also called the gliding movement, and the type is the synovial hinge joint. Now I will show you the articular surfaces of the knee joint. Lower part of the femur, this lower part has two condyles. One on the medial side is called the medial condyle, other on the lateral side is called the lateral condyle of the femur. The medial condyle is more narrow and it is more curved as compared to the lateral condyle. Posterior side, this is more curved, this is less curved, this is narrow and this is broad. So this is a property of the medial condyle and the lateral condyle of the femur. Now the upper parts of the tibia, these are the upper parts of the tibia, which are also called the tibial plateau, this one and this one. So this is the plane surface, and the lower part of the femur is the curved surface. So in the knee joint, the lower surface of the femur, which is curved, and the plane upper surface of the tibia both forms a joint. You can see this rotatory round surface lies over the plane surface of the tibia, and in front of this, or in between the femur and the tibia, there is another bone which is called patella. So the knee joint has two type of articulations. The one articulation which is between the femur and the tibia, this articulation is called femorotibial articulation, and this femorotibial is of two types. One on the medial side is called the medial femorotibial, and one on the lateral side is called the lateral femorotibial articulation. Next, the other type of the articulation is femoropatellar articulation, which lies between the lower end of the femur and here another bone which is called the patella. The articulation of the knee joint is comparatively weaker. The curved surface, as I told before, which is sitting on the plane surface of the tibia. So it seems that the two balls, these two balls, they both are sitting on a wrapped table top. This is a tabletop, these are the two balls, and these two balls are sitting. So if this joint is like the hip joint or the shoulder joint, in which the one surface is convex and the other surface is concave, so the convexity will fix into the concavity, that will make the joint more stable. But as in case of the knee joint, this is a convex surface and the other surface is very flat, that's why this is comparatively unstable joint. The next most important thing in the knee joint is the capsule of the knee joint. The capsule of the knee joint has two layers, one the outer layer and one the inner layer. The outer layer is called the fibrous layer and the inner layer is called the synovial membrane. First of all, we will study the fibrous layer of the capsule of the knee joint. You can see the two surfaces, one is the femoral surface, other is the tibial surface. Both have two parts, anterior part of the femur anterior part of the tibia, posterior part of the femur, and the posterior part of the tibia. The blue color over here shows the articular cartilage. The articular surface one side and the other side, both the surfaces of the femur and both the surfaces of the tibia are covered by hyaline cartilage, which is articular cartilage. So we start the attachment of the fibrous layer. The outer fibrous layer is both thick and thin variety. The thick variety forms the ligaments. You can see on this model, these all ligaments are formed by the thickness of the fibrous layer, and the thin part which is directly attached with the bones. On the femur, the fibrous layers surrounds the articular cartilages, or you can say that the articular cartilages lies inside the fibrous layer, and it runs upward. And you can see the demarcation of this fibrous layer on this model. It runs like this and encircles the whole articular surface and surrounds the lower part of the femur. Then it moves posteriorly like this, and posteriorly again it will move upward, and it surrounds the both condyles along with their articular cartilages, and then also the posterior intercondylar fossa. The gap between the two condyles on the posterior side, this is called the posterior intercondylar fossa. So the fibrous layer surrounds the condyles along with their cartilages and also the posterior intercondylar fossa. This is the pattern of the attachment of the fibrous layer on the lower part of the femur. And on the tibia, the fibrous layer surrounds the condyles of the tibia along with their articular cartilages, as the articular cartilages lies on the upper part of these condyles, and this fibrous layer runs with the tibial condyles from this side and then from this side, and then runs posteriorly, and it encircles the whole of the tibia. But on the posterior side of the tibia, just above the fibula, the fibrous layer is deficient, and the tendon of the popliteus muscle enters from this fibrous layer and to attach itself up to the tibia. There is the tendon of quadriceps femoris muscle. The red color shows the tendon of the quadriceps femoris, and below this there is a bone which is called patella, that is absent on this model, but this is the impression of the patella bone. And below the quadriceps femoris muscle is continuous as the patellar ligament. This ligament is formed by the thickening of the fibrous layer of the capsule of the knee joint. Interiorly, the fibrous layer, when comes from this side and when from this side, it is attached on the lateral sides of the patellar ligament and also on the lateral sides of the tendon of the quadriceps femoris muscle. Here up to here and here, and then the whole this area, on all these sides, the fibrous layer of the capsule of the knee joint is attached here. And posteriorly, as I told before, this layer is deficient because it gives a pathway to the tendon of the popliteus muscle. So the two deficiencies, one on the anterior side, one on the posterior side, but the posterior side, it is actually called deficiency because this is a gap. Gap gives a pathway for the entrance of the tendon of the popliteus muscle. But this is not actually called the deficiency because the fibrous layer is attached on both the sides of the tendon of the quadriceps femoris muscle, on the patella and on the patellar ligament. One thing which is very important about the fibrous layer is that the fibrous layer lies a little bit away from the articular cartilages. There is a gap, you can see in this model, a gap between the articular cartilage and the attachment of the fibrous layer. But the second layer, which is the synovial membrane or the synovial layer, this layer is closely attached or adherent to the articular cartilages. And now I will demarcate the site of the attachment of the synovial layer. As I told before, that outer layer is a fibrous layer, inner layer is the synovial layer. It is attached directly or very closely to the articular cartilages like this, and then it moves posteriorly like this, a whole area of the articular cartilages, and same below on the articular cartilages of the tibia. You can see the blue color on the tibia over here and here, and the white color boundary on this model, which is the fibrocartilaginous structure, and this is called the menisci. The two menisci, one is on the lateral side, which is called the lateral meniscus, one on the medial side, which is called the medial meniscus. And the benefit of this meniscus is that it gives a friction-free movement of the femur on tibia. This friction-free movement, and it is fibrocartilaginous structure. And this is the concavity, again the convexity, but on this model that the femur moves on the tibia very smoothly. So the synovial layer is attached very close to the articular cartilages of both the femur and the tibia, and also the menisci on their edges, and the patella bone over here. This layer moves posteriorly, and posteriorly it is also attached with the articular cartilages, with the menisci around their boundaries. On the upper part of the tibial plateau, the white colored structure, which is the menisci on the both the side, right and the left side. And the central part of this menisci, from the anterior side and from the posterior side, there are the ligamentous structure, and there are two types of the ligament. One is called the anterior cruciate ligament, another is called the posterior cruciate ligament. We will discuss these ligaments later on in detail. The synovial layer or the synovial membrane, when passes from the posterior side of the tibia, it runs inward from this side or from this side to inside the joint cavity, and as it moves inward from posterior side, it enters into the anterior side. Here anteriorly it receives a bone which is called patella, impression of patella. Over here it receives the patella. So as it moves inward, it bathes the cruciate ligaments, and immediately it will receive the patella bone. So here this forms a fold, and the fold is called the infrapatellar synovial fold. I will show you the fold on a book of anatomy, and this is KLM. This purple color layer, which is the fibrous layer of the capsule, and the red color layer is the synovial layer. I demonstrated these layers on the model, but according to me, this is the best diagram which will tell you the attachment of the fibrous and the synovial layer, and also the folds. So the fibrous layer is attached on the periphery. I told it that this lies away from the articular cartilages, and the red color, which is a synovial membrane or synovial layer, is directly attached with the articular cartilages. So you can see the gap between the fibrous layer and the synovial layer. The fibrous layer leaves some deficiencies. This is the posterior aspect, this is the anterior aspect, and this deficiency gives a pathway for the entrance of the tendon of the popliteus muscle, and anteriorly this layer is attached with the patellar ligament and with the tendon of the quadriceps femoris muscle and with the patella bone. But the synovial layer, which is red in this picture, this layer is attached with the articular cartilage very closely, and then very closely on the lateral aspect. Then this layer will move from the posterior aspect and surround the articular cartilages when it will enter into the joint cavity medially, surround the articular cartilages medially, and then it will move anteriorly, and anteriorly it will protrude from the anterior intercondylar area. It will protrude from here, which is anterior intercondylar area. It will protrude from here. Here it will receive the patella bone, and this is a patellar ligament. But in the center, this forms a fold, folds of the synovial layer or the synovial membrane over here, and this fold is called infrapatellar synovial fold. So the two folds, one on the right side, one on the left side. The two folds are formed, and these are the cruciate ligament, which are green in color in this picture. The posterior cruciate ligament, the anterior cruciate ligament. This synovial membrane bathes the cruciate ligament. This layer, when enters from posterior aspect to anterior, it receives immediately the cruciate ligaments, receives immediately the cruciate ligaments, so it bathes them. And anteriorly, this layer again form a fold, and this fold is called the alar fold. So you can say that alar fold is formed by the lateral part of the synovial membrane, and the infrapatellar fold is formed by the medial part of the synovial membrane. The books mentioned is the fatty folds. These folds actually looks like the fat, so these are called the fatty folds, but actually these are the part of the synovial membrane, the protrusion of the synovial membrane. One from the posterior aspect of the joint cavity, and when it will move interiorly, it forms the infrapatellar synovial fold. And when the lateral aspect of the synovial membrane moves anteriorly, this form again a fold which is called the alar fold. The alar fold lies behind the patellar ligament. This fold lies behind the patella. At the front, this is a bone which is a patella bone over here, and then the ligament which is the patellar ligament. And when I will lift the patellar ligament and the patella, behind there is the fold, and that fold is called alar fold. So alar fold has two structures interiorly. One is patella bone or the patellar ligament, and behind the patellar ligament is the patella bone. This is another picture that will show you the infrapatellar synovial fold. That fold extends from the interior aspect of the joint cavity. As you can see, the interior aspect of the joint cavity, and then it will move at the front. This whole elongated fold is infrapatellar synovial fold. This is the extended leg. But when that person will flex his or her leg, that fold will move inward. Extended posture, it's vertical, but in flexed posture, that fold maximally will move inward. Synovial membrane over here, the synovial membrane is purple in color. The attachment is very close to the articular cartilages. These are the articular cartilages, and this is the synovial membrane. Again the synovial membrane, and this fold is derived from the synovial membrane. That's why this is a part of synovial membrane. It looks like some part looks like the fatty tissue, so this is called the fatty folds. Again on the lateral sides, the two folds which are alar folds. On the lateral side, the lateral alar fold, and on the medial side, the medial alar fold. And behind the medial and lateral alar folds are infrapatellar synovial folds. And the whole purple color, either in the form of the fold or a form of the layer, this is called the synovial membrane. Outside the synovial membrane is the fibrous layer, and which is white in color in this model, or outside the purple color is a white color which is the fibrous layer. You can see the fibrous layer outside the purple layer. But this is the upper part, this is the lower part. At the upper part, the fibrous layer is attached with the tendon of the quadriceps femoris muscle above, below with the patella, and then below with the patellar ligament. And posteriorly, there is entrance of the tendon of the popliteus muscle. That's why posteriorly this layer is deficient. It will give the pathway to the entrance of the tendon of the popliteus muscle. Here the popliteus muscle is cut, and this is the muscle with its fascia, with its belly, and this is the tendon. So we have finished the type of the joint, the movements on the joint, the capsule of the joint, and next time we will do the ligaments associated with the knee joint and with the bursae, which is a very important topic with locking and unlocking mechanism. Thank you so much. Allah Hafiz.